So the next one is pharmacological and parenteral therapies, and it's 15% of the test. Now, what I'm betting should scare you a little bit about this is you can't possibly know all the drugs. There are new drugs coming out every single day. Ketamine was approved for suicidal ideation and such this week. Like every single day, something different is coming out. And you can't know all of it. So the nurse receives medical prescriptions for the client with whatever disease or symptoms. So you can take that question statement alone and the rest of your clinicals say, okay, so I have this person with this disease and these symptoms. What am I going to do about that? What do I need to look for? What do I need to monitor? So you can make the end of that stem anything that you wanted. Okay? The nurse administers which medication first. So let's say you had somebody who had heart failure, and you've got furosemide ordered, you've got normal saline at KVO ordered, you've got maybe one of your beta blockers. How are you going to decide which thing is first? And you can, I mean, you're already starting to insert ideas in there, right? So if your patient has heart failure and they're having difficulty breathing, which one are you going to do first? You're going to give that furosemide so you can start pulling fluid off and fix the problem, right? It wouldn't make any sense to put the beta blocker in first. That's going to take a hot minute. Furosemide, we're going to just put in the IV and they're going to start to diurese, and that's going to help fast. The nurse monitors the client receiving whichever drug for whichever side effect or adverse effect or lab value. So you can put in anything that you wanted to here. Name any drug that you have to monitor a lab value for.
Digoxin.
Digoxin. All right, so the nurse monitors the client receiving digoxin for which, let's go with an abnormal lab value. What labs are you worried about with digoxin besides just the digoxin level? Potassium, yep. So whether the potassium is low or high, you can craft your own question based around those ideas. Versus, let's see, the nurse monitors the client receiving vancomycin for which therapeutic effect? What would be the therapeutic effect of vancomycin?
Rid of bacteria.
Decreasing infection, decreasing like TIP, white blood cell.
So we're looking for their white blood cell count to trend downward. We're looking for decreased signs of infection. So maybe there's a wound in the question and we're looking for decreased purulence, for example. What if we said we're talking about the client's receiving vancomycin and now we want to assess for which adverse effect? What kind of problems happen if vancomycin is given?
The red man.
Red man syndrome might be one. What might be another one? What's vancomycin toxic to? Say it out loud.
Vein.
The kidney.
So it could be extravasation issues, but kidneys. Vancomycin is nephrotoxic. So one of the things that you're monitoring when you give that, one of the adverse effects could be acute renal failure. So you're looking at lab values like creatinine and BUN when you give it to you, in addition to just the vancomycin level.